the tongue, and the pharynx. Which cranial nerve comes into your mind? Yes, it's glossopharyngeal for your tongue and the pharynx. Okay, we are looking into the base of the brain. You can see the medulla oblongata and you observe anteriorly the pyramids. You can see them, and then you find that there lies here exit of the cranial nerves, including the glossopharyngeal from the posterolateral sulcus in between the olives here and the inferior cerebellar peduncle, right? Okay, we are looking into the cross section of the medulla oblongata to observe the nuclei of the glossopharyngeal nerve. This is the, let me mark, the motor nucleus or the nucleus ambiguous of the glossopharyngeal nerve. Now I want to show you another nucleus which is called as the inferior salivatory nucleus. This inferior salivatory is also called as parasympathetic nucleus of glossopharyngeal nerve. Now I have to mark for you the nucleus of the tractus solitarius, which is the sensory nucleus of glossopharyngeal nerve, right? Now there is another important thing regarding the three, that this nucleus ambiguous is having corticonuclear fibers coming bilaterally, or you can say that both cerebral hemispheres are giving fibers to the nucleus ambiguous, right? And being a motor nucleus, we will see that it will innervate the only one muscle called as stylopharyngeus, right? Now I have to show you that which other nuclei is receiving the bilateral innervation. That one is the nucleus of that tractus solitarius. It is also receiving the corticonuclear fibers from both the cerebral hemisphere. This is important. I wanted to tell you before moving the rest of the course of the glossopharyngeal nerve, right? Okay, if you concentrate, let me mark for you that this is the jugular foramen through which you can see the fibers of the glossopharyngeal nerve is coming downwards. After exiting through the skull, the nerve has got the superior ganglion and the larger inferior ganglion. They carry the pseudo-unipolar neurons in it. Now you can see the nerve is commencing downwards and reaching towards this stylopharyngeus muscle to supply, and this is the motor supply to this very single muscle of the glossopharyngeal nerve being innervated, right? Now, as I've told you that the stylopharyngeus muscle is being supplied by the motor division of the glossopharyngeal nerve, which comes from the nucleus ambiguous, right? If we go back. Now concentrate, what else is there? You can observe another important thing, that there lies the carotid body at the bifurcation of the internal carotid commencement artery. Now here concentrate that let me mark, this is the jugular foramen, and after exiting through near the base of the skull, the glossopharyngeal nerve has got the superior ganglion and the larger inferior ganglion laden with the pseudo-unipolar neurons. And from here you can see that the motor fibers from the nucleus ambiguous are coming downwards to supply that stylopharyngeus muscle, right? And what else is there? After that motor supply, we have to concentrate for another important thing, that at the commencement of the internal carotid artery, we have got the carotid sinus and the carotid body, and from here the sensations are moving upwards, as we know that they carry the, or they are the baroreceptors, and they are meant to sense your regulation of arterial blood pressure, I would say. And what else is there? They are to deal with your carotid sinus reflexes, and for this nerve will ascend, I would say, upwards, and will finally, when it reaches to the medulla oblongata, here it terminates in the nucleus of the tractus solitarius, right? And are connecting to the another nucleus that is located in the medulla oblongata is the dorsal motor nucleus of vagus. Why it is connected to it? Because it has to maintain the carotid sinus reflex and of course the management of your blood pressure, right? Now we have to observe that information from your tongue, tonsil, soft palate and the pharyngeal area are going upwards, and via this glossopharyngeal nerve they are supposed to reach towards your nucleus of the tractus solitarius, and general sensations are supposed to enter into another nucleus located in the medulla oblongata called as the spinal nucleus of the trigeminal nerve. What else I have to say? That the special taste fibers from the posterior one third of the tongue and the circumvallate papillae, they are also being innervated by this glossopharyngeal nerve, right? Okay, if you concentrate, another important thing, that this glossopharyngeal nerve, that is to pass through its two ganglion, it give rise to a tympanic branch and enter into the tympanic plexus, and then from here it has to give rise to the lesser petrosal nerve and then entering into the aortic ganglion, because it has to supply the secretomotor fibers to your parotid gland, and it will use the auricular temporal nerve of the fifth cranial nerve, that is the trigeminal nerve, right? Okay, to revise the various branches of the glossopharyngeal nerve, just concentrate that first there lies the tympanic nerve, then comes the nerve to stylopharyngeus, a motor nerve, then you observe the pharyngeal branches, then the tonsillar branches, and lingual nerve is there, and the carotid sinus nerve is there, right? And another branch, the lesser petrosal nerve, right? In this way you can remember the branches of the glossopharyngeal nerve, right? Okay, if you want to concentrate the gustatory pathway, or you can say the taste pathway, for which we have to learn about the various cranial nerves. You can see that anterior two-third is being supplied by the facial nerve via its chorda tympani branch, right? It is ascending upwards towards the medulla oblongata, and here what is going to happen, that it has to reach before this into the geniculate ganglion, and then its central process or its fibers of the neurons, they are supposed to enter into the tractus solitarius, that is located into the medulla oblongata, right? And now let me mark that what happens to that of the posterior one-third area of the tongue, that is being supplied for the taste fibers via the glossopharyngeal nerve, and this glossopharyngeal nerve is taking the information and has to ascend through its ganglion, the inferior and the superior ganglion, and then it has to reach again into the tractus solitarius, which is located into the medulla oblongata, right? Now you can see here in this diagram, let me repeat, the facial nerve is taking information from the anterior two-third, the taste fibers, and of course the papillae located here, and the glossopharyngeal is taking the gustatory information from the posterior one-third, and of course the circumvallate papillae, right? Now concentrate that there lies the vagus nerve, the most posterior one-third, and it gets sensory information and the taste sensation and ascending upwards towards the medulla oblongata up to the tractus solitarius nucleus, right? And of course this vagus nerve, before reaching to the nucleus of the tractus solitarius, has to pass through its inferior ganglion, then it will enter the nucleus of the tractus solitarius. Okay, what happens that after being relaying in this nucleus of the tractus solitarius, all these nerves, they are supposed to reach towards your thalamus, right? And in the thalamus they will relay in the ventroposteromedial nucleus, and then they have to reach towards your gustatory cortex, and that could be the lower part of your postcentral gyrus, right? That is called as the area of the taste, and you can observe that it could be lying in the insula as well, right?